medicine space and where we still need to go. Let me introduce Charles Platkin, the Executive Director of the Center for Food as Medicine and Longevity and a distinguished lecturer emeritus at Hunter College. Give him a round of applause. Nice to see you. Dr. Geeta Maker-Clark, the Director of Integrative Nutrition and Advocacy at Endeavor Health and Co-Director of Culinary Medicine for the Pritzker School of Medicine at the University of Chicago. Phew. Got through it. A-dae Romero-Briones is the Vice President of Policy and Research at the First Nations Development Institute. Round of applause for everyone, please. And Dr. Robert Graham is a physician, chef, and co-founder of Fresh Med NYC. Give him a round of applause. Thank you all for being here. I really appreciate it. A-dae, I'd like to start with you. You and I have talked about this quite a bit because you're a trusted and valued advisor to Food Tank, so I depend on you. We've talked about how the idea of food as medicine has become increasingly clinical and individualistic, and why we're overlooking so much as a result of that. Can you talk about that?
Absolutely. Can you hear me?
Can folks hear
Can
her?
you hear me? Okay, yes. Well, thank you for that question. I think individualistic is the appropriate word here. I work with tribal communities, and one of the most critical ideas around food, around community, especially around health, is the idea that health is not only dependent on just what one person does, but it's dependent on what the community around you does and how healthy your environment is. And so when you isolate those things, individuals seem to be in control of everything they do when it comes to health.
Right.
But really, there's so many things around you, including environment, including your friends, including your family,
Right.
including your community, that have so much impact on on how healthy you are, but how you define health in general. And in America, when everything becomes an individual action or even an individual fault, we really lose sight of all of these other impacts that create a healthy person
Yeah.
and therefore a healthy community and a healthy environment.
And there's so much blame and shame involved too, and I think that's, we have to think of it as a community issue or problem, or, people are going to feel very bad about themselves.
Absolutely. When you think about, and I use this example a lot in my community, if one person is sick, it's an issue. But if you have 5 people that are sick, it's the idea is like you have to look at the systematic inputs that create that
right.
unhealthy 5 people when it's like 10 people. And now we have like epidemics. And at some point you have to look at systematic triggers and issues that are affecting not only one person, but entire communities.
Absolutely. A-dae, I'm going to ask this question to you and Charles. And it's, Charles, starting with you, could you provide some context to help us understand how the food as medicine movement has evolved and what has contributed to the shift that we're kind of seeing today?
So I guess I would talk specifically about that food as medicine is not really new. We've been using it actually in our own society for a very long time. Think of scurvy and vitamin C, rickets, all the things, beriberi, all these things have been solved by food as medicine, and they still are today. They're common, right? We have infused milk and things like that with vitamin D, and enriched foods. And so I think that food as medicine, there was a sort of a divide that took place when surgery and medicine started to evolve, and it became kind of the wealthy started to move toward the surgery and the pharma, and the poor kept staying with the food as medicine. And then I think we realized in the last, let's say, 10 years or 15 or 20 years that, hey, well, there's a lot to this that we should be thinking about. And now it's sort of merging. And I think that the merging is really important. We don't want to do without pharma, because pharma is very important. We don't want to do without physicians and all the great treatments that have evolved over the last 100 years, but food as medicine plays an incredible role. The last 2 years, all I've been doing is researching how food and dietary supplements can impact disease and treatment, and it's remarkable. And I was just talking about that with Marion Essel right before I got on here. So I think that this is really important to understand so that we can move forward and merge everything and converge and really come to some great new encounters with medicine.
Sure. A-dae, do you want to talk about how we need to recognize sort of, the wrongs, though, that have happened, and especially in our tribal and native communities because of this sort of clinical part of medicine and food?
Yeah, I think when we focus solely on Western ideas about what health and medicine and we lose a whole, like Charles said, this is a very old concept, and there's so many paradigms and people in this world who have very succinct ideas, old ideas about what health is and about how to keep a person healthy. But when we put those solely in a Western paradigm, we lose a lot of knowledge, and we teach ourselves not to see some of the solutions that people have been implementing for generations.
Absolutely.
Very
They
well
need to
said.
be honored and recognized. Charles, do you want to?
No, I was just saying that's exactly well said, and
Yeah.
and so many people have been damaged by that
Yeah.
convergence, the lack of convergence. I think that it's important to recognize that.
Absolutely. Geeta, if I can turn to you, for food as medicine to be community focused and have a community impact, can you talk about the kind of training that is really necessary in healthcare settings to be able to do that, to understand people and where they're coming from?
Yeah. Yeah, thanks for the question. I think to build on what A-dae is saying is there's an incredible and an undue burden put on the individual right now, especially in American society, to be responsible for our own health, right? And like you mentioned, there's a lot of shame and blame that comes from that if you're feeling like, well, I'm not doing a good job at the things I know I'm supposed to be doing, and this is entirely my responsibility to do it. The goal is collective care, right? The goal is collective liberation for all of us, truly. That's the real goal, I would say, of this food as medicine movement. We've lost our way a bit. You know, I'm very happy the movement is a movement. I've been at this for a very long time, and it's so wonderful to have a panel like this and to have colleagues in the field and not be the only person who's kind of talking about it, which we've all sort of been there, like little lonely wolves in our institutions. However, I think the movement has been a bit reductionist in the sense that it's still putting a lot of undue responsibility on that individual and it's more consumer driven, right? The wellness industry has sort of like taken hold of food as medicine.
Yeah.
And so from the education perspective where I sit and the community health perspective, I feel like we need to reclaim this philosophy as our own in our communities and train our physicians and train our children through education to have soil that they can grow from that's based on knowledge, because there is no home economics anymore, right? Like I had home ec. I don't know how many of you had home ec. A few people in there. Like I might have been the last class of home ec in high school. Like we learned how to sew a quilt, you know, like what? But we learned how to cook some things for ourselves, you know, and I feel like kids don't have that kind of knowledge anymore. They don't have that ancestral, traditional wisdom that food as medicine is based on. So in culinary medicine, we are training medical students, you know, to understand that food is a medicine, but also how to talk about it. What's the vocabulary to speak with patients who have multiple chronic diseases, who have cancer, about how they can use food as a medicine in practical translational ways, not just in like vague, you should eat more fruits and vegetable ways that everybody knows.
Yeah.
So, and then I also work in Chicago Public Schools because I do think that children really need to have this information.
Sure.
And it's astonishing how brilliant kids are. Like they get it.
Yeah.
And so it's very rewarding to work with kids. And, you know, I'll give you an example of teaching them about the bliss point, right? Which is a term that has been created by food scientists that makes a processed food very hard to put down, right? So you open your bag of chips and you're like, I'm just gonna have a couple. And then the chips, you know, the whole bag of chips is gone, right? In like 15 minutes. How did that happen? How did that happen? That's not your personal failing. That's because the bliss point was baked into those foods in a lab. So if you teach kids that, I'm not saying don't eat chips, but I'm saying now you know why it's really hard to put the bag down, and they get it. And so there's power in that.
There is power.
And that's the key.
Yeah, and it's
power back to the community.
Yeah, that collective liberation you talked about. Robert, if I can turn to you, you know, food as medicine is no doubt gaining so much support, but there are still barriers and obstacles from it becoming more widely adopted. I wonder what you're seeing, you know, as doctors have to jump through hoops to get, you know, prescription programs to their patients.
Well, I think, you know, the way I like to look at it is I like to look at it as a microenvironment and a macro environment, right? So the macro environment is everything we're talking about. The community health, public health, and public health is best when it's silent, right? When it's just sitting there and no one knows that it's being activated, right? Because it's just the default. But yet, the way we enter medicine, it's very individualistic, right? And so to change, I think we should do everything at the same time. It's really it's a food system transformation and a health system transformation that has to happen, right? While honoring, our traditional ways, ancient wisdom, but at the same time, we have to find a way, and I think a lot of what's happening now in the food as medicine movement is really focusing on that microenvironment. And as much as I love and hate literally prescribing food as medicine with this movement, I believe it has to start there, and I've been a big believer in educating, starting culinary medicine way back in the day, before it was called culinary medicine. But the end user is the patient. And it takes so long for first to educate the physician, to change the curricula, and then translate that knowledge to the patient.
Yeah.
While the entire health system, there's geniuses in nutrition that's been around for a long time called registered dietitians, right? And so the way I feel that we have to do this is, if you have a chronic disease or if you have a non-communicable chronic disease that is diet-related, which we know is most of what we're facing today's epidemic, refer them to dietitians. And at the same time,
A lot of dietitians in the audience.
yes. So more coverage for registered dietitians, and at the same time, start prescribing medically tailored meals, produce prescription boxes. But the problem we have in today's society is that the health system that we're working within doesn't have the workflow to support it.
Yeah.
Right?
We
There's
need that
not a button.
infrastructure.
There's not a button that I can press to say, diabetic, uncontrolled A1C, refer to dietitians. You can do that. Covered by insurance, and then medically tailored meals for a certain time, transition them to produce prescriptions. We don't have that, so it falls on many companies and institutions, nonprofits, to build that system.
Yeah.
And man, it's hard to build a
Yeah.
system within a very sort of prescriptive system.
Yeah, and I imagine it's become even harder. I'm going to turn to Charles for a minute, but you can also talk about this question. Geeta talked about the wellness industry or the wellness community, but it's also an industry and the growth of that, especially right now. There is so much misinformation out there, and I wonder how you're all trying to sort of counteract that. Charles?
Yeah, so I think that one of the things that I talk about a lot is social media, TikTok, and I'm sure you're all familiar with it. Coming home and seeing your daughter drinking chlorophyll, and saying it's going to cure acne or whatever it might be, knowing that this is my space, it's really an insult, and not asking me specifically. And then realizing that, wow, there's so much misinformation out there. So one of the reasons why I formed the Center for Food as Medicine and Longevity is we have 17 PhDs working on creating literature reviews that'll be updated every week once we launch, with starting with 40 different disease states, and it'll be a resource for physicians, for dietitians to do the work. We do the work so they don't have to, basically, right? And that's really what our objective is. And then eventually, once I get funding, we'll add things like having social media monitoring, right? When we see disinformation, be able to intercede immediately.
Sure.
And those are the kinds of things I see in the next 3 to 5 years for us working on, and really trying to dispel the myths that are out there that are very confusing, even for experts.
Yeah, absolutely. Geeta, I want you to touch on that point, but I also want you to talk about why then because of this misinformation that's out there, it's so important for people in healthcare to have more knowledge about food as medicine and nutrition, because right now it's getting better, but right now medical schools don't have a lot of training around nutrition and food as medicine.
That's right. So nutrition education has been absent in most of medical education for the last 40 or 50 years. Only in the advent of this sort of culinary medicine movement of the last 10 years or so are we starting to see even a couple of hours start to be infused in. And of course, as Robert alluded to, the goal is not to have doctors be nutritionists. That's what nutritionists are for. But your doctor still needs to know something about medicine, about food as medicine, and that's not something that we were necessarily trained in. So I do think that piece is vital. that we reintroduce nutrition as a extremely important and vital part of health education, just as important as pathology and histology and every rotation that we do in medical school. And that is happening. We have 80 academic medical centers in the country that offer culinary medicine across this country, and it's also spread into much of Europe now too. So there's good news. But I will say that the advent, I'm going to call it the advent of wellness influencers is really challenging because, you know, most of my practice is spending time dispelling information that patients are bringing to me. You know, like, what, I'm taking this, or I started this diet, and like, what do you think about it? And I have to take some time to like really look at what they're doing and sort of, you know, discern which of it is helpful and which of it could be harmful. And that's the piece, is like, it's fine if it's neutral, but a lot of it's harmful. That's being peddled by people who don't have the information, and they're doing it irresponsibly in ways that they don't have no liability for. Whereas like Charles and me and Robert have a lot of liability when we say the wrong things to patients. And I don't mean even just like financial liability. I mean like personal. It's like, this is what we're in this business, is trying to help people be better, right? So we're never going to say something that we think is going to harm somebody. So it is a really particular challenge right now, and I think the responsibility for, again, the individual is very heavy to try to make that discernment, but I still do believe that your doctor is a great place to go with your questions.
With that, Robert,
really do.
Yeah, but all
for you
not
to
doctors,
comment.
I got to say, not all doctors are created equal, right? And so,
For
you
sure.
know,
They're all like Robert.
Yeah, well, you and Geeta, too, you know, like we're education, training matters, science matters, right? And so we've spent a lot of time in my career, right? I'm speaking on behalf of. We spent a lot of time learning, crafting, educating. And again, it's hard, right? Because the news cycle is so fast. But to your point, like, there are certain things that have always been true, right? Eat more plants. I think we have to sort of simplify the message as well, and not sort of get to this point that the N of one, you know, it helped me, so that it's going to help everyone, right? And so we rely on public health. We rely on community health. We rely on ancestral health. There's a reason why certain cultures gravitate to a certain specific food, because it's been part of their ancestor, part of their culture. And I think we've stepped away from that and really focusing on the now and the N of one, and not the community that we've been talking about. And again, look for doctors that are trained in lifestyle medicine, culinary medicine. There are trainings now, certificates, functional medicine, integrative medicine. There are doctors now that have taken extra courses beyond medical school to inform themselves on how to best deliver the type of care that my mother, my wife, my family wants. And I think we have to sort of advocate for ourselves and not look, you know, oftentimes I joke, one more thing I have to say, we spend more time thinking about where we're going to dinner than who your doctor is.
Yeah, absolutely, absolutely. But this cultural aspect that you're talking about goes back to where we started with this conversation today. I'm wondering if, you know, if we can help communities ensure control of their own food systems, how can this, you know, not just build community health, but what we all want and why we're here at Climate Week, which is planetary health as well?
I think at some point we have to recognize that the ideas about health and about medicine should not be defined by health, by wellness social advocates, or whatever you may call them. In indigenous cultures, we have the same thing. At one time, it was the medical community who kind of takes indigenous ideas about what health, knowledge, and medicine is, and then maybe appropriates it. I mean, it's a similar process that seems to be happening over and over again. At some point, as a community, or whatever community you may be from, we have to take some control over the definitions about health, about medicine, and about what we do as a community collective about some of these things.
Right, and the semantics really matter. The language really matters. And you know, I think, you know, in this last 30 seconds, very quickly, call to action from each of you for this audience. Charles.
Think before you eat and take anything.
Thank you. Geeta.
Eat more plants.
Robert.
Eat less meat.
Think about your grandparents and what they ate.
Beautiful way to end. Thank you all so much. This was great. Please give them a huge round of applause. Thank you all.
Thank you very much, Danielle.
Thank you. while they're getting off the stage. Thank you again so much. I want to quickly thank you, Geeta, a few more of our in-kind partners who have made today's reception so special: Impossible, the American Frozen Food Institute, and Simply. I also want to give a shameless plug. Hey, people, sit down. Don't go anywhere. I also want to give a shameless plug. If you like summits like these, we can only do this because of our grassroots members. We encourage you to look at foodtank.com/join if you feel so inclined, and you join at the cultivator, planter, or grower level. That's the word. You can get a food tank cutting board today. So thank you all.